Today, we are going to a community in the central region. This is Cape Coast Teaching Hospital. You know, the issue of the
Lightwave,
Lightwave
yeah.
health information system has really come under some sort of scrutiny, let me put it that way. Akando, who is the current health minister, has said that there was overcharges and all that, overpayment, let me put it that way, overpayments that was done by the previous administration. That's Dr. Bernard Okoboy. Dr. Bernard Okoboy has also come out to also say his side of the story and all that. But we are looking at the situation at a facility in Cape Coast where our correspondent Akwesi Ado went there to file a report. He has indicated that regarding the Lightwave information system that has been shut down is really having a toll on the facility. Let's bring you that report. After, we will engage Akwesi and find out more from him.
Training for staff of the Cape Coast Teaching Hospital on the new Ghana Health Information Management System (GIMS), which replaces the Lightwave Information Management System, began on Friday, November 7, 2025, and is expected to conclude on Monday, November 10. However, departmental heads were reportedly issued a sudden directive on Sunday instructing that all patients on admission should have their notes and medications copied and pasted onto Word within the next 10 minutes. LEMS were shut down. Sources at the facility told ChannelOne News that the directive caused confusion and frustration among health workers as the system went offline abruptly. Following the shutdown, staff have reverted to manually recording patient information, a process that has significantly slowed operations, especially at the outpatient department (OPD). Although management of the hospital has denied that the shutdown was unplanned, they acknowledged that it has increased waiting times for patients.
We were officially asked to um, now prepare for games today, and so LIMS went off from our system, and then we are expecting to receive games today. But I am not aware of any directive coming from management to migrate anything to Word or whatever. So interim, we've gone back to the paper system, and so we are using folders. Some places are using exercise books and other stuff just to be able to. When there are challenges, we don't dwell so much on the challenges. We see how best we'll be able to solve these challenges. So Cape Coast Teaching Hospital went back to the paper system.
Public Relations Officer of CCTH, Frederick Nyanka, told ChannelOne News that the hospital expects to complete its transition to the GIMS platform by close of Monday, barring any unforeseen challenges. He added that staff are being adequately trained to effectively operate the new system.
So we received a directive from the ministries concerning the transition from LEMS to GIMS. And for Cape Coast Teaching Hospital, we started preparing from last week. We've had a series of training from officials from the ministries, and they've taken our staffs, our doctors, and our nurses, and other members of the staff of Cape Coast Teaching Hospital through various training. We are hoping that we end our training today, and we are hoping that all things being equal, by close of day, we should be able to come live with the games.
Management further assured that all patient data currently recorded manually will be safely migrated to the new digital system and fully protected.
No, I don't think they should be worried concerning their data. Probably they should be worried concerning waiting time. It will extend some of their waiting times. Like for instance, today, um, the normal time that you have to spend at OPD came with some extra minutes. That's where the worry should be.
So that is the comment coming from the Cape Coast Teaching Hospital that has reverted to manual record keeping after the sudden shutdown of the Lightwave Health Information Management System. The move has led to long queue time, or waiting time rather, for patients seeking care at the facility. Let's speak to Akwesi Ado, who is our correspondent in the central region, to get more details on this and what really the ramification is concerning the shutdown of the Lightwave Health Information Management System. Akwesi, good morning.
Good morning, Philip.
I trust you are doing well.
Very well. Hope you are too.
Okay, good. I want to find out from you, when you visited the facility, can you tell us in a day, how many individuals or patients visit this facility?
Well, Philip, this is Central Region's biggest health facility, and it is a referral point for many of the facilities here in the Central Region. And then it also caters for residents in Cape Coast and its surrounding areas. So you can imagine the number of patients that visit this particular facility in a day. Talk of those who are referred to the facility, talk of emergency cases that are taken to the facility, plus those who go there to seek treatment from its outpatient department. So we're talking about, if not thousands, several hundreds of people in a day.
Take us through the process. If a patient is brought to the facility, maybe the patient has been attending this facility for some time, will they now go into the records, pull the folder, come to the OPD, take it to the consulting room? Like, take us through the process. How is it like?
So currently speaking, if you are visiting the Cape Coast Teaching Hospital as a first timer, it means that your records would be captured in a folder or in an exercise book. But if you are someone who is a regular visitor, it still means that your records should be taken in an exercise book or notebook, because now the Lightwave Health Information Management System is completely shut, and then the facility no longer has access to it. So you would still be treated as, let's say, a first timer. And so you would still have to go to the records department for your records to be captured. Then you would proceed to the OPD to see a physician.
All right, so isn't this troubling, especially for people who have already had their records in the hospital? And when it comes to human lives or when it comes to someone's health, you can actually have a history of something. So how does how does the whole thing work, especially if you have a history of medical problems?
This is really difficult to tell, and it's even difficult for the health workers themselves, because you cannot, even as a patient, you cannot have every record or detail concerning your health in your head, that which you can easily recall. Even with regards to your medication, you might not be able to remember the kind of medication that were given to you the previous time you visited. And so it's really a very challenging time. Even though management has assured that once games is deployed, they would be able to transfer data from LIMS to the games platform. Currently speaking, because we do know that games has not been deployed yet, even though management had mentioned that games was expected to be deployed on Monday. Today is Thursday, and per our checks, games isn't still, it hasn't come to life, and it is not being used. So it's difficult to fetch previous data of patients who visit the facility.
All right, so what you're clearly saying is that they didn't have like a backup for all the information that they gathered of their patients. So there's no place that there's an extra backup, even if it's a pen drive, if it's something, at least where you have people's information, even though you are not using LIMS.
So, Chris, this is actually what happened on Sunday. So it was around afternoon, and then heads of departments for the Cape Coast Teaching Hospital received this message, and let me quote: "Good afternoon, please. All patients on admission should have their notes, medications, etc., copied and pasted onto Word within the next 10 minutes. LEMS was shut down." And according to our sources there, it was really a moment of frustration and desperation for the medical staff, because how can you copy all this record onto Word within 10 minutes? And exactly just as the directive mentioned, the limbs went off, and so we do not know whether they were even able to copy those records onto the Word document or not. Even though the facility is denying that that particular directive, which I read, was given, our sources are also, insisting that, look, this is the directive that was given us. And so for now, it is not clear whether the departmental heads or persons who were on duty at that material time when the directive was given were able to copy any sort of data onto the Word. And we do not know how they'd be able to even transfer the data from Word onto games.
Right. So how did this message come in? Was it in the form of an email, a text message? What is it?
So this was shared on various WhatsApp platforms and then directly to departmental heads of the facility. Now, let me also even mention that, games may be different. The interface of the software may be quite different from LIMS. And so staff would have to be trained on how to utilize the games platform. That training for staff began on the 7th of November. That should be somewhere around last week, Friday, and was expected to conclude on the 10th of November, which was Monday. But as we speak now, we have not been updated by the facility as to whether the training was successful or not. And remember when we did this story on Monday, the PRO for Cape Coast Teaching Hospital, Frederick Nyanka, mentioned that they were expecting for games to go live on Monday. But as I speak with you now, it is still that old practice of keeping records in folders and then exercise books that is being used because games has not been deployed at CCTH yet.
Well, Akwesi, thank you so much for your time. You've been able to at least capture the entire situation at the Cape Coast Teaching Hospital and tell us what really the issue is when the Lightwave information system has been shut down. But if you heard him talking about games, October 29, 2025, there was a press conference, let me say, accountability series, where the health minister met the press. And at that particular press conference, he indicated that the introduction of a new digital health platform, that is the Ghana Health Information Management System, which is the GIMS, to replace the suspended Lightwave Health Information Management System. He explained that the move marks the end of manual medical record keeping in Ghana's health facilities. As to whether it is happening now, you can tell because you've seen it happening at the Cape Coast Teaching Hospital, where the records are still taken manually. We've not moved to.
When you said marks the end, wasn't LIMS doing that already?
Well, you know, with the LIMS, there are issues. Yes, they are trying to unravel some issues that has come out with. The previous health minister spoke about it extensively, that the amount of money that was paid, was it its right course? Now the health minister currently says that there is an overpayment and all that. But with the games that he is indicating, he said that it's fully state-owned and managed system designed to improve the security and accessibility of health information across the country. Speaking at the media engagement at Jubilee House, the minister revealed that the decision followed forensic and technical audit that uncovered serious problems with the previous Lightwave Information Management System project. According to him, this $100 million, that is the Lightwave Information Management System contract awarded in 2019 to connect 950 health facilities, was expected to be completed in 2022. However, after 2 extensions, the contractor still failed to meet key targets. So, quoting the minister, he says that by the time the contract expires in December 2024, only 450 facilities had been connected, less than half of the original target, even though 77 million US dollars had already been paid, representing more than 70% of the total cost, he revealed. The audit also found shortages and poor quality equipment, with the estimated 29 million US dollars worth of supplies either missing or below standard. That is what the minister also added. The minister described the contractor's refusal to hand over the administrative assets and Ghana's health data as pure blackmail, saying it caused repeated service disruption and data losses. To fix these challenges, he noted that the ministry has now developed, that is GIMS, a new national digital health system built entirely by the government. The system, he noted, includes the National Health Information Exchange and a secure platform that allows different health service providers to connect under government regulation, preventing any singular company from controlling national health data, among other things that the minister said. So the long and short of the issue is that LIMS is now off and we are bringing GIMS. But even though LIMS is off and GIMS is yet to come, like Akwesi indicated, as of Monday, GIMS was supposed to come. The issue...
I'm boiling.
Why?
I'm boiling. You don't understand. This is people's health that they are playing with. Do you understand? Information about your health or the history of your health is very important for your health provider. It's very important for your doctor. Some people do not keep all this information in their heads. That's why we have these systems. See, I don't know how it's going to come out. I don't care about LIMS or GIMS or whatever it is. There should be a system. There should be a system that does not play with the history of people's health. People are battling kidney diseases. People are battling liver diseases. People are battling diabetes. People are battling so many things. There could be records of your health for some years ago that can help you today.
Yeah, record history.
Do you understand? So it's like you are mixing up everything again for another doctor to start figuring. Okay, imagine the doctor that was treating me 5 years ago in this same hospital. It's no more there. Moved to another place. It's another new doctor. So now a new doctor is now coming to be asking me, "Hey, madam, what's your history? Do you remember what medicine you used to take? Do you remember what you see? You know, when it comes to allergies and all that and medicines that are not good for you, we the people that are not even health professionals, we don't know the names. Sometimes you might say, okay, some doctors use word like NSAID, use word like this and that. I don't even know what it is, but the doctors know. So they know that, okay, this medicine is not for you, or this medicine is not great at this time. Oh, Jesus.
And they're here playing with LIMS and GIMS.
Oh, Jesus. See, I'm emotional when it comes to health. Like, I get very emotional, and I feel emotional because it always affects the vulnerable. It always affects the ones that don't have money like you. It always affects the people that are not able to pay for the private hospitals and are not using the GIMS and the LIMS and the this and that. Do you understand? It always affects those people more because you can pay for an institution or you can pay for a hospital that's not using any of these things that they will never even miss your history once. You know, there are some hospitals, I go to some hospitals, I don't want to call names or promote any place, but you go to hospital, madam, you are this, and you were this weight during this time. You know, they know everything. Charlie, I'm sad.
There's a message coming here. Good morning. I'm not sure they would be able to transfer the patient's history from LIMS to GIMS. They said same when they were moving from HAMS to LIMS.
You see?
Again, they are going to maintain the same folder numbers, or they are going to change the LIMS number.
No, are they going to maintain?
Okay, the same numbers, or are they going to change the LIMS number? This is Danny from Koforidua.
And I'm sure this Danny has probably worked in
the health system.
In the health system, because he said, he categorically said that the same thing happened when they were moving from HAMS to LIMS, and no patient's history was transferred. This is 2025. We're still playing with people's health in the name of LIMS, HAMS, GIMS. If another government come, they'll bring another one again. It can be BIM. Oh, Jesus. Oh my. No, like I have goosebumps.
Yeah,
I'm very
yeah.
emotional. I feel like, oh, Charlie.
Well, so that is it for you. We brought you from the Cape Coast Teaching Hospital. I'm sure if the health minister is watching, maybe you would want to tell us what really the update is with games, because if it's not only this facility, maybe we are using the Cape Coast Teaching Hospital as a case study. It may be happening at Kolebo Teaching Hospital. Look at the number of people that come to Kolebo Teaching Hospital in a day. Not to talk of Greater Accra Regional Hospital, or even to talk about the CATH, that is a Confanaut Teaching Hospital, or even go to the Volta region, Trafalgar, that is a teaching hospital also in the Volta region, and other satellite clinics and all that. So please, this games, limbs thing, we know the issue, but we should move away from it.
And I think we need to remind them of the rates of, at which the diseases are just increasing and health problems are just increasing in the system. And this is not the time to start playing with people's history. Anyway.
But relax, Mr. Kando announced that games will be rolled out in phases over 4 weeks, starting with teaching and regional hospitals, followed by district hospitals, polyclinics, health centers, and CHIP compounds. He added that the audit finding has been forwarded to the Attorney General and other state security agencies for further investigation into and appropriate actions. Before we go on a break, please, if we are doing these games, we should do it very well.
Yeah.
Reason is, if we are moving away from the Lightwave health information management system, and we think that there is a problem with it, and we are now coming up with games, which is the Ghana Health Information Management System, it should be done properly. So that the next minute, another government will not come and say that we have issues with the previous one and we would have to change it. The more we keep doing that, the more we lose information. Like Chris said, sometimes you need to base on the history. So my history will help the doctor to see what I have been taking in the past and what he can predict in the future. You understand?
And
let's not be dilly-dallying with our health.
Of, okay, if what Akwesi said is actually true, because he actually believes his source, that they gave them 10 minutes to move information. Even with my own laptop.
How can you transfer?
I don't even have a hospital. Even with my own laptop, to move it to, even my phone, to move it from another, to move the information from one phone to a new phone, it doesn't take 10 minutes. It takes more than 10 minutes, sometimes overnight. And you're expecting games to move to Word in 10 minutes.
Anyway, that's it for you. From our community, we went to the Central Region, Cape Coast Teaching Hospital, and games, limbs, harms, all the things, the abbreviations are playing in there. But please, let's do the needful and let's save lives of the general public. Let's go.